Addiction is a complex disease of the brain and body that involves compulsive use of one or more substances despite serious health and social consequences. Addiction disrupts regions of the brain that are responsible for reward, motivation, learning, judgment, and memory. Addiction damages your health and various body systems as well as families, relationships, workplaces, and neighborhoods. Some people think addiction cannot be a disease because it is caused by the individual's choice to use drugs or alcohol. While the first use or early stage use may be by choice, once the brain has been changed by addiction, most experts believe that the addict loses control of their behavior and the ability to make good choices becomes impaired. Choice does not determine whether someone has a disease. Heart disease, diabetes, and some forms of cancer involve personal choices like diet, exercise, sun exposure, etc. A disease is what happens in the body as a result of those choices. Addiction is defined as a disease by most medical associations, including the American Medical Association and the American Society of Addiction Medicine. Like diabetes, cancer, and heart disease, addiction is caused by a combination of behavioral, environmental, and biological factors. Genetic risk factors account for about half of the likelihood that an individual will develop an addiction. The consequences of untreated addiction often include other physical and mental health disorders that require medical attention. If left untreated over time, addiction becomes more severe, disabling, and even life-threatening. People feel pleasure when basic needs such as hunger and thirst are satisfied. In most cases, these feelings of pleasure are caused by the release of certain chemicals in the brain that are associated with pleasure or reward. Over time, continued release of these chemicals causes changes in the brain system involved in reward, motivation, and memory. When these changes occur, a person may need the drug to feel normal. The individual may experience intense desires of craving for the addictive substance and will continue to use it despite the harmful or dangerous consequences. An addicted person will also prefer the drug to other healthy pleasures and may lose interest in normal life activities. In the most chronic form of the disease, addiction can cause a person to stop caring about their own or others' well-being or even survival. These harmful changes in the brain can remain for a long time, even after the person stops using. It is believed that these changes may leave those suffering from the disease of addiction vulnerable to physical and environmental cues that they associate with drug use. These mental mechanisms are also known as triggers, which can increase risk and relapse. A chronic disease is a long-lasting condition that can be controlled but not cured. About 25 to 50% of people with a substance use problem appear to have a severe chronic disorder. For them, addiction is a progressive, relapsing disease that requires intensive treatments and continuing aftercare and monitoring. Family and peer support can be very helpful in managing the process of recovery. The great news is that even the most severe chronic form of addiction can be manageable and reversible, usually with long-term treatment, continued monitoring, and support. The initial and early decision to use substances reflects a person's conscious choice. Everyone makes choices about whether to use substances or not. However, people do not choose how their brain and body respond to drugs and alcohol, which is why people who have become addicted cannot control the drug's use while others can. People who suffer from addiction can still stop using. It's just much harder than it is for someone who has not become addicted. Support from professionals, family members, and friends is critical in increasing the addict's chances of survival and recovery. To gain an in-depth perspective regarding the disease of addiction, please watch our film titled Pleasure Unwoven. This documentary by Dr. Kevin McCulley takes an easy-to-understand positive look at the disease of addiction. Links to our films can be found in the description. Contact us at the Institute for Addiction Study. The link to our website is also in the description.